Hi, I'm Dr. Richard Brownlee. I'm a neurosurgeon at the Welcome Back MRI and Pain Management Center in Kamloops. I'm actually doing this talk inside our open upright MRI machine. So today we're going to talk about sacroiliac joints and sacroiliac joint pain. So what are the sacroiliac joints? This is a model of a spine. So your spine consists of vertebrae and discs in the front of the spine, and at the back of the spine there's an arch of bone and little joints called facet joints, and then all the nerves in your spinal cord are within the confines of that bony spine. Your sacroiliac joint is actually part of your pelvis. So your spine sits on your pelvis. It sits on the part of the pelvis called the sacrum, which is what this bone is here. Your tailbone or coccyx is at the lower end of your sacrum. And then your iliac bones, there's one on each side, are joined to the sacrum by ligaments, and the joint between the sacrum and the ilium is called the sacroiliac joint. So there's one on each side. It's not like facet joints. It's not truly a mobile joint like a knee and a hip. It's just two bones that are held together by ligaments. So there's a bit of flexibility, but the joint really doesn't move a whole lot. Changes in those ligaments can lead to more mobility of the sacroiliac joints. Women, when they're pregnant, estrogen causes ligaments to become more mobile or looser, and women often get sacroiliac joint pain during their pregnancy. The sacroiliac joints are also a common source of pain as we get older, because people can get degenerative changes within the sacroiliac joints. So if you have pain in the lower back or in the back of your hips, that's often arising from the sacroiliac joints. Unfortunately, there's no really good treatment for sacroiliac joint pain. People are given exercises to try to strengthen the ligaments and the muscles around the joints, which can be very helpful. Sometimes cortisone injections into the joint can help get rid of the inflammation and can relieve the pain for a variable period of time. Some people get weeks worth of pain relief. Some people can get months or even years. There is another procedure that we do called sacroiliac joint rhizotomies, which involves putting in a series of needles with an electrode, passing an electric current, and it actually cauterizes the branches of these nerves that go to the sacroiliac joint. People don't lose any feeling or any weakness because you're only cauterizing the nerves to the sacroiliac joint, and that can often relieve pain for a year or more. And if the pain comes back, it can be repeated. It's a minimally invasive procedure that's done under local anesthetic. But you need an x-ray machine called a fluoroscope so that you can see where you're putting the needles. You don't want to put them in the wrong place, or you could damage a nerve and cause some weakness or numbness or even some bladder problems. So if you do it properly under x-ray guidance, you can get rid of the pain from the sacroiliac joint without having any complications or side effects. So in terms of chronic back pain, I think the facet joints are probably the most common source of pain, but the sacroiliac joint is probably the second most common source of low back pain. The discs are a much less common source of low back pain. So if you have chronic low back pain, sacroiliac joint is certainly a possibility. So you could ask your family physician to send you for what's called a sacroiliac joint block or injection. They often do those in the x-ray department, and that's both a test and a treatment. When they put local anesthetic in, it freezes the joint, and if that gets rid of your pain, that confirms that's where your pain's coming from. Putting the cortisone in is the anti-inflammatory, and like I said, that can get rid of your pain for weeks or sometimes months, and then rhizotomies can give you even longer pain relief. If you want more information about sacroiliac joint pain or facet joint pain, you can go to our website. There's a number of videos that describe what facet joint syndrome is, what sacroiliac joint syndrome is, and the videos explain how these blocks are performed and how rhizotomies are performed. They're very informative and they're quite short. I think you'd enjoy them. So if you want more information, just go to the website for the Welcome Back MRI Center in Kamloops.